I am a professor at university, and I'm going to speak about these topics. I'm independent of authorities, not engaged with any of them, and then I'm a certified toxicologist, just confirmed yesterday. These are my areas of expertise: 3 R's, alternative to animal studies, because I'm a toxicologist, and then I work very much in human biomonitoring. And besides that, I'm a chair of several ethics committees, which is also relevant in this respect. I would like to start with the question, why pesticides? Well, we would like to increase the yield. That's why they were introduced many years ago to a very large extent, because we now have hotels for insects, because as you all have discovered, we have very few insects today compared with what was the situation 50 years ago. And that's actually a problem. So that's why we have to make hotels for insects, and we have to make pesticides that are very targeted. And we may not even need pesticides, because the picture below the field is actually from an organic farmer in Jutland, where he doesn't use pesticides with big and nice results. Where are the pesticides? We already had the headlines of food, soil, and water. And then I came across very interesting data from the Environmental Protection Agency. They have a research program, and they were collecting hairs all around the country and examined the pelt, but also the blood and the urine and the liver. And they actually detected pesticides in the pelt, like tibuconazole. It's a fungicide. We find it in humans as well. Boscalid, also a fungicide, same thing in humans, and prosulfocarb as well. And the thinner, glyphosate, which is impossible to get rid of, was of course also present in the hairs. And this is actually a very good monitoring instrument, having the hairs running around in the fields, collecting what has actually been sprayed. And I know it's going to be used in new studies as well. One too much. Maybe you should do it. We have some cases of pesticide production in Denmark. Illegal in Denmark today, but Cheminova, which has been featured in a recent television program, produced tons of malathion and other forbidden chemicals, and still do. So the area around Cheminova in Harboøre Tange is heavily polluted. Same in Grænsted, where the other picture is from. So we have benefits from pesticides, but we certainly also have the opposite. Maybe you should just do the training. And this is from Information, which was mentioned in the introduction by Klaus, where they have depicted where the drinking water collection areas and where pesticides are sprayed. And it's not a very nice picture, because it tells us that it goes to the area where you are getting your drinking water. So that's one of the sources of pesticides. I ran a campaign for Danmarks Naturfredning some years ago with families. 5 families were enrolled. They were non-ecologic. They were having a traditional diet, but then they went to an organic diet for 2 weeks. And we collected urine samples before and after. And as you can see in the last column, the number of pesticides detected in the urine leveled down dramatically when you went for the organic diet. Well, that doesn't tell anything about health. Yes, it does. We know these pesticides are not healthy to insects, and they are not healthy to humans either. But going for an organic diet might limit your risk. Can you take the next one? Yes, that was the one I wanted you. The next one. Then we have some other data which I can present here with the most commonly used food groups where you find pesticides. And as you can see, you have something below the level of quantification, some above, and then some are even above the maximum resident level, which is set by the authorities. So don't go for spinaches in some instances, and tomatoes may also be filled with pesticides. These data are from 2022. The next slide is from Europe, and this is waters, rivers, lakes, and groundwater, where you see the exceedings of thresholds of pesticides levels. Denmark is taking in a nice, no red color on Denmark, only something on the groundwater. But this is not a nice situation. We find pesticides residues in active drinking water, drills, sorry, it's only in Danish. This is done by GEOS, and you can see it's actually increasing. And next one is then from a human biomonitoring study. That's my field of research, where we collect biological samples and measure for concentrations or effects of different molecules, for example, the pesticides. Not yet, please. And this slide is from a big European study where we collected samples in the same way from different countries and analyzed for 3 PPA, pyrethroate, and as you can see, it actually exceeded the levels in children as well as in adults, but much more in children. And this was an eye-opener in our human biomonitoring program. I don't think we expected it to be that high. The next one tells us something about the use of pesticides. Actually, I think Lea would have told us that it is decreasing in Denmark in the latest statistics, but on the world market, it grows. And it's mostly herbicides, but also the fungicides and insecticides are on stake. Yes, there are really many kinds of pesticides, and you have to be very specific if you want to discuss risks of pesticides, because we have the mode of entrance and we have the chemical composition, and then we have a lot of other characteristics which need to be taken into account when you discuss them. And the next slide tells you something about the human effects. We spray the pesticides, it becomes present in the water stream, and from our studies of populations as well as animal studies, we find an increased frequency of neurological disorders. And actually in the US, there are some cases on Parkinson associated to exposures to pesticides. We're not that far in Denmark yet, but I'm part of a proposal to study that further on Danish samples. Then we have respiratory diseases, asthma. But what worries us most is actually the reproductive health impacts. Because what we find in continuous studies of even different pesticides, because the pesticides we use in the northern part of Europe is different from what we use elsewhere, is some effects on the reproduction. No, too quick. Decreased fertility and also decreased quality of the children, and we may also have immunotoxic effects as well as something on the neurological side. Some studies indicate associations to ADHD and autism with exposures to chemicals, including the pesticides. And then, of course, we have the cancer, and we have endocrine disruption. And I didn't even write in the toxic effects, but it should have been there as well. So the next one tells you about glyphosate, which is classified as a pesticide, a cancer, and we have a few others. And that's just to say that it's well recognized that some pesticides are carcinogenic. And the next one is a busy slide, but this tells you what is the pathways of pesticides and which kind of organs might be affected. And you have the different life stages as well, and you have the population variability. So it fulfills the full picture of getting into the body and have the possibility of adverse effects. And the next one shows you the adverse effects on children, which is what worries us very much. And we have some pathways of toxicity that can explain the way that the pesticides work. So this is the picture of what the risks are of pesticide exposures at the current levels. And you can see we have different abnormalities reported as well. We have nice Danish studies supporting this, mainly from Southern University in Denmark, but they are in line with other studies. And the next one is glyphosate, where you can just take the next one, glyphosate, which is a very specific inhibitor in plants, but it also works in humans. That's why it's carcinogenic. And the next one is more about the toxicity that we know that glyphosate actually inhibits. And the next one is a more toxicological one, telling you that all those terrible effects I listed, they are actually found at very low levels. And the next one is another one. That's a pyrethroid, which is actually in use today. It's synthetic, and the primary source for humans is in food, and it can be measured in urine and at concentrations that may be associated, when we get more knowledge, to irritancy, neurotoxic, and reproductive toxicity. The next one is tibuconazole. It's a fungicide, and it's also classified as having moderate toxicity and a risk to the reproductive effects. We find that in all our human biomonitoring studies that I know of in Denmark. Next one are organophosphates. Chlor-PFAS is forbidden, has been that for quite some years. It's neurotoxic, that's why it was forbidden, but it's also an endocrine disruptor. You can provide me with a urine sample. I'm convinced I can measure it. It's still present in Europeans and in Danes. And that's also the case for the next one, which was mentioned by the previous speaker, chlorothalonil. It's forbidden in Denmark, has been that for quite some time. And even though it has been forbidden for many years, we can still find it in blood, and it's associated to endocrine disruption. So that's the picture of some of the pesticides I know of in Denmark. The next slide is about the elephant in the room, the TFA, which is increasing during the years, not only associated with pesticides, but other fluorinated compounds. And as you can see, it's found in groundwater in Denmark in increased levels. And the next slide shows you how it looks. Very small, very active ionic molecule, which is found everywhere, in the rainwater, for example. We don't know very much about the human health relevance yet, but some new German studies have indicated reproductive toxicity. I have it in myself in the laboratory because we precipitate proteins with that compound. But it has some effects on the endocrine disruption as well. And the next slide is I borrowed from my colleague in Lund, and it's very difficult to measure. And he has set up a nice analytical method. But what you need to be sure is that you don't contaminate. And the next one are levels found in urine and serum all around the world. And you can see it has been traced in many kind of populations. And I know of some Danish data also showing the presence of TFA in urine. Yeah. And this is something about the pathology pathway, which tells you that the pesticides can affect many different kind of pathways. And the way forward in approving and forbidding pesticides might not be big epidemiological studies taking many years or big animal studies, not necessarily looking at human relevant effects, but we might rather go for in vitro test with organoids, and even better in silico test, where you collect all the data you have, and then you try to see whether you can tell something from the new compound. And that's actually the new way of classifying pesticides. And I think I have one more. Yes, my final point. It's not easy for the different boards to collaborate. In Denmark, we have the environmental board. They are concerned about the environment. They do all the approving and detecting exercises related to pesticides, but they don't care very much about health. And that should actually be part of the Board of Health work. Unfortunately, they have closed down all their activities related to environment and health this year due to lack of resources. So we are in kind of a limbo related to environment versus health. And in the middle of this slide, I could have written food and agriculture, which also plays a role. And maybe I'm not the one to answer whether this also is the case in the EU, but maybe it's the same. Thank you.
Okay, thank you for so comprehensively covering many issues and substances and challenges that we're facing. I think we have time for 1 or 2 questions to Lisbeth Knudsen. There are any questions? Yeah, we have a question here. And please present yourself and short questions.
Thank you for a very nice presentation, which should be also...
And your name?
Oh, I'm sorry. Subilakul from Organic Denmark. And yes, once again, thank you for your presentation. I think really it is an alarming presentation. It should really make people think. I'm interested to hear, do you also make research in cocktail? Do you say cocktail effect?
Yeah. It's difficult. When you do human biomonitoring, you get everything. So you may, in fact, take human sample and not just only measure the components, but also test the endocrine disrupting effect. Then it will be the effect of the cocktail. Some of my toxicological colleagues at DTU, they test mixtures of, for example, azoles, fungicides, and see whether they have a cocktail effect, implying that they add on to each other. You can't just consider one of them, but you have to consider the full cocktail.
Okay, and we can take a final question to Lisbeth Knudsen. There are more questions here on the front.
Hi, thank you for the presentation. I'm a journalist and Talking about the different agencies in Denmark and their different perspectives, do you think that silo thinking within science and health is a big problem and can be due to?
I didn't ask for that question. I fully agree.
Okay, could you do to solve it, and what solutions could you point to?
That there is silo thinking within the universities. We keep our projects for ourselves, even within the same university. And that's a pity because we have different qualifications and could actually work better together. That's one issue. Better science, better teams. But for the ministries, it's definitely also my experience that they work in silos. I was the Danish National Hub coordinator of a big human biomonitoring European study, and we had all the agencies in that, and they were sitting in each country and pushing the questions around. I know that the PFAS issue has brought them tighter together. In fact, and that's what they're saying themselves, that they have come to talk to each other. But then today we learned that the food agency is cut dramatically. So maybe that would cut this collaboration. I don't know. Thank you.